It is my honor today to introduce our commencement speaker, Dr. Laura Magana. She is currently the President and CEO of the Association of Schools and Programs of Public Health, or as we know it, ASPPH. And prior to joining ASPPH, Dr. Magaña dedicated more than 35 years to successfully leading the advancement of public and private universities in Mexico, educational organizations in the USA, United Nations programs, and NGOs in Central America and Europe. And she was most recently the Dean of the School of Public Health at the National Institute of Public Health in Cuernavaca. Under Dr. Magaña's leadership, ASPPH has strengthened the capacity of all of its member institutions, like our own school, by advancing leadership, excellence, and collaboration for academic public health. We could not be more pleased to have her today as our commencement speaker. Please join me in giving a very warm, at least a 62-degree, welcome to Dr. Laura Magana.
Good evening, and congratulations to the class of 2019. It is so great to be back on a campus. Before I became president of ASPPH, most of my career was spent in the university environment. And one of the things I miss most is the life of a school. Noisy, surrounded by students full of energy and joy. I spent 13 years commencements with my public health students, so thank you, Dean Finnegan, for letting me make that 14. I barely remember my own commencement, but I do remember well my graduate studies, and I remember how challenging they were. I started my PhD studies at the same time that my husband was starting his diplomatic career. My daughter Anna was 3 years old, and my daughter Jessica was 3 months old. I was working in the morning, part-time, attending classes most afternoons, arriving home late in the afternoon to take care of my girls. When they would sleep, I would study. So one time, Anna came to sit in my lap. I was underlining my psychology textbook, which had a lot of pictures. And Anna asked me, "Mommy, what are you doing? Why are you scratching your books?" So I told her, "I'm not scratching them. I'm underlining, Anna, so I can remember all the important things." The next day, Anna said, "Mom, I did your homework." I underlined the most important parts of your book so you can sleep earlier. So when I opened my textbook, guess what? All the pictures were scratched, of course. She was doing her best to help so I wouldn't have to stay up working. Graduate school is challenging, and the support of family and friends is key to our success. Now, probably your loved ones did not highlight your textbooks for you, but maybe they helped financially or emotionally. Even more importantly, they shape your values, which likely contributed to your decision to study public health. So let's recognize them. Their ongoing support as you start on your new careers will remain essential. Thank you, families, for being here with us. And graduates, what a wonderful accomplishment to arrive at this day. Maybe you work while getting your degree. Perhaps, like me, you were raising families while keeping up with your studies. Maybe you are in this city or even in this country alone. And look at you now. You're here. You made it. What an amazing class you are. I see you in front of me, almost like a mosaic. Different shapes and hues, but all forming one beautiful figure, the public health workforce of the future. In a few moments, all of you will be graduates of this incredible institution. And all of you have chosen to be part of the most noble profession. You have chosen public health, the art and science of preventing diseases, prolonging life, and promoting the health and well-being of people everywhere. Wow. I believe public health is a calling. Our profession is about caring. It's about giving. It takes being hands-on, building trust in communities. It means advocating for social justice, being the voice of the invisible, and not leaving anyone behind. This is radical, almost unthinkable in our modern, individualistic, and often selfish society. Already you have felt this calling in your time in the Twin Cities. When you connected Minnesotans living in food swamps to farmers markets, you didn't do that because it was prestigious or paid well. You were making sure not to leave anyone behind. When you studied how Minnesotans' jails provide health care for pregnant women who have abused opioids, you were being a voice for the invisible. And because of the dedicated men and women before us who have made public health their calling, just think about how many people now live healthier and happier lives. 75 years ago, when this school was first established, the average boy born in the US could expect to live a little over 63 years. Today, it's over 77. Back then, smallpox killed hundreds of millions. Polio paralyzed thousands. Today, both are almost entirely eradicated. And as you know, the story of public health in America is in many ways the story of this great school. As far back as 1869, this university's first president, Dr. William Watts, envisioned a time, and I quote, when a Department of Public Health will be established in all universities. I close the quote. A few years later, the University of Minnesota was one of the founding groups of the American Public Health Association. In many ways, as Dean Finnegan has written, the University of Minnesota is the national birthplace of academic public health. And through the years, this school has been instrumental in advancing the public health agenda. It was faculty of the University of Minnesota that helped show that smoking was a major cause of heart disease and helped pass the first citywide ban on cigarette vending machines. It was the University of Minnesota that advanced requiring all new buildings be fully accessible to people with disabilities. Years before Will Smith brought chronic traumatic encephalopathy, CTE, to the big screen, it was faculty of the University of Minnesota that first linked youth football to high rates of concussion. And right now, this school is leading a zero-tolerance movement to sexual harassment and discrimination that will transform our culture. For 75 years, you have been pioneers in public health, asking probing questions, encouraging innovation, advocating for society's most vulnerable populations. That is the proud legacy that you are part of, and now you are prepared to advance. And that is the pioneering spirit we need now more than ever. Because if you look around us, as much progress as we have made, it is obvious that we face daunting challenges. It seems like every day the news brings apocalyptic developments and dystopian predictions. This year, the Pulitzer Prize was awarded to 3 different newspapers for their coverage of 3 different mass shootings. In the last 10 years, deaths from alcohol, drugs, and suicide have more than doubled. Just in this period, in these 10 years, over 1 million Americans have died just from these very 3 preventable causes. We are confronting the existential challenges of climate change, and experts like Michael Osterholm warn us about the perils of a potential pandemic. These challenges are only exacerbated by growing social inequalities that dramatically affect the health conditions. So we see this gap between the countries. If you're a child in Angola, your chances of dying before age 5 are 90 times higher than if your child is of a child in Finland. We also see this gap within countries. In Washington, D.C., where I now live, you can get on the metro in Montgomery County, ride to Southeast D.C., and in 15 metro stops, the average life expectancy will drop 7 years. Now, there are just 2 ways to approach these concerns. We can panic, become paralyzed, We can isolate ourselves in bunkers or even build walls. Or we can choose to believe that this generation, your generation, is smart enough, bold enough, concerned enough for humanity that we can defy the predictions and build a better world. My choice? I'm betting on you. I believe I'm looking at the leaders, researchers, practitioners, advocates, and policymakers that will heal our broken world. The last 75 years of public health saw huge progress, but unfortunately, these advances have been distributed unevenly. I believe the challenge of the next 75 years will be to make sure that everyone has access to better health outcomes. It's our responsibility to work for more just and equal access to the conditions that make us healthy in the first place. As Pastor Charles Swindoll said, we are all faced with a series of great opportunities, brilliantly disguised as impossible situations. So, class of 2019, you have work to do. And as you prepare to take on those great opportunities, disguised as impossible situations, allow me to offer just 3 lessons from my own life, because it would not be a commencement address without some advice, right? So, lesson 1, make a way out of no way. Don't take no as a response. Do what is right. Stand for what you believe. Many times in your careers, you will run into obstacles, layers of bureaucracy, outdated societal expectations, skeptical colleagues. You need to persist. You need to forge the way. In 2004, I was hired as Dean of the School of Public Health of Mexico at the National Institute of Public Health. No woman had held the position. Nobody who wasn't a physician had the position. But I was determined. I had the passion and educational background to transform the School of Public Health of Mexico into one of the leading institutions in Latin America. As part of my initial plans to restructure the school, I wanted the international accreditation. So for that reason, I approached CIF, the Council on Education for Public Health, to start the process. Well, I discovered it would be a very short process because they didn't accredit schools outside the United States. So I said, public health is global health. Why shouldn't CIF accredit international institutions? At that time, there were already visionary ASPPH leaders like Dean Finnegan that were pushing from within to welcome international members. So I just kept pushing and addressing the old guard's concern. I knew that while CIF accreditation would benefit my school, I also knew that our inclusion would also benefit CIF and existing accredited institutions. So eventually, because we didn't give up, CIF and ASPPH changed their outlook and criteria. My School of Public Health, the INSP, became the first CIF-accredited public health school outside the United States. Only 12 years later, I was offered the privilege and honor to lead ASPPH, the first woman and the first senior leader from an international member to hold the position. Dean Finnegan was a leader in the internationalization effort, but 12 years ago, I don't think either of us thought I would be standing here today. My career trajectory has shown me that you should never underestimate your ability and persistence to transform the status quo. The changes might take time, but it is with small actions that we eventually change the larger reality. Keep in mind the words of Dr. Martin Luther King Jr. The ultimate measure of a person is not where he or she stands in moments of comfort and convenience, but where he or she stands at times of challenge and controversy. So we are not called to conform to this world. We are called to transform and shape our own future. So don't let anything stand in your way. Lesson 2, think globally and act locally. I know it's counterintuitive. During my professional and diplomatic career, I have lived in 4 countries on 3 continents. I have proudly worked all my life to make all the organizations that I have worked with more international. And here I am telling you to focus first on your own backyard. I strongly believe that you need to start with your own communities. I remember some years ago, I was living in Michigan, working with a Hispanic population who happened to have the highest high school dropout rate here in the States. I lived in West Bloomfield, which is still affluent suburb, and the students I work with live in Pontiac, a very deprived community. And one Sunday at our church, the pastor told me that several teenagers at the church wanted to go overseas. They were from wealthy and middle-class families, and they wanted to do something to improve communities in developing countries. They were talking about going to Guatemala or even as far as Africa. So I met with a teenagers group, and I said, I work 20 minutes from here. I just want you to meet the kids where I work, and then we can organize an international trip. So the students came to Pontiac. They saw more than one family with 4 or 5 members each living in a single home, sometimes in only one bedroom, sometimes with no heating, or with broken windows, even in the Michigan winter. These young people never thought that there were people living in such difficult conditions just a few miles from them, right next door. And after that, they decided to start mentoring these kids and leave the international trip for later. The University of Minnesota has a strong commitment for global health. But as you have learned here, whatever you were working in a urban community or in rural Minnesota, our immediate responsibility is within our immediate communities. Last lesson, never stop strengthening your human competencies. The degree that you have so proudly earned today signifies that you have achieved a high level of technical and professional competencies. But impressive as they are, the real success in your careers will be measured not so much on the technical competencies, but in the human competencies that you have developed. Your empathy, your compassion, your humility, your tenacity, your courage, your generosity. These are the competencies that our world needs the most, and these are going to be the competencies that will take you far. I want to leave you with one final thought. Of course, it's about soccer. I hope we have some fans here. Who thinks that the goalkeeper is the most important player on a soccer team? Not many people, right? The goalie may be well-trained, but he or she is the last line of defense. It's the other players who make the team great, right? On a really great team, the goalie will never come into play. The same is true when we think about health. The goalkeeper is the health system, physicians and hospitals. If everybody else fails, they are there. But there are 10 more people trying to keep the ball outside the goal, trying to keep the ball outside the goal. That's the conditions where we live, learn, work, and play. It's our climate, our lifestyle, our food, our exercise. It's the housing, the work, and the educational opportunities. It's environment. That's all of us. That's public health turf. When I look at you, I see the most incredible team. Talented, passionate, compassionate, and I think that with you on the field, we can give the goalkeeper a break. This is a time for public health. This is our time. We have an opportunity almost to make magic in this world. And as great as our challenges are, with you on the field, I know the progress we have made in the last 75 years of this school's life will be nothing compared to what the graduates of this school will achieve in the next 75. So, class of 2019, the world is waiting for your leadership. Congratulations.